Well, authorities opened the Manchester Emergency Operations Center here at the Central Fire Station earlier today, where city leaders held a meeting this afternoon. Representatives from the Elliott Catholic Medical Center, AMR, the airport, Manchester schools, and the fire department gathered here for about an hour earlier to discuss COVID-19. They've used the EOC in the past for other coronavirus instances like SARS and MERS. Right now, they say they're in an enhanced monitoring status, gathering information from the state and federal governments and making sure they're prepared if any cases arise here in the Queen City.
There are no known cases here in Manchester, but what we are doing is being preventative and planning ahead. So we've enacted the Emergency Operations Center. Our police department, fire department, health department for years have been preparing for emergency situations. So this is something that they're very used to doing.
They're asking anyone who may be showing any symptoms to stay at home and avoid going to work. Live in Manchester, I'm Charisse LeClaire, WMUR News 9.
Tonight, health officials say they've got in touch with everyone who came in close contact with one of the people who tested positive for COVID-19 at an event in White River Junction. But the Upper Valley has activated a regional team to monitor the situation across that region. WMUR's Kristen Carosa is live in Lebanon.
Tom, a meeting was held right here at the fire department in Lebanon. The discussion lasted for several hours to make sure everyone was on the same page. This meeting in Lebanon Wednesday is in response to the first 2 positive cases of coronavirus in New Hampshire. Both are in Grafton County.
We don't have an outbreak in our region at this particular time, and we are making sure that if that does occur, that we are ready to respond to that.
One of the cases is an employee of Dartmouth Hitchcock Medical Center who recently traveled to Italy. He was instructed by the state to self-isolate before he was tested, but he didn't do that.
I'm disappointed, and we've had to take measures, and we've worked very closely with the state. We know that this employee did not have contact with patients during a time in which we thought this individual would have been infectious.
The second person who tested positive came in contact with that person. Both are isolated at this time. Hospital staff are now asking patients who traveled to at-risk countries to postpone medical appointments for 14 days after returning home to the U.S.
Everyone's been really compliant and pretty calm about things.
The hospital says if people have symptoms, call their doctor. If needed, a test will be done with the help of the state.
We are working to develop our independent capability of running our own tests that we should have up and running. This doesn't mean that we'll use confirmatory testing with the state, but will allow us to do this.
Health officials are reminding people to be diligent about their hand washing to prevent the spread of this virus. We're live in Lebanon tonight. Kristen Carosa, WMUR News 9.